Now, there's an increase in deaths in the care homes in the United Kingdom. Let's find out more from Caroline Kennedy. Hello, Caroline.
Hello, Alma.
Hi, what are your updates for us?
So on Tuesday, Britain said that it would extend its reporting of deaths within the coronavirus outbreak to care homes and the wider community, after new statistics indicated that the country had been underreporting its tolls. Until now, only the deaths of people who have tested positive in hospitals have been reported. 586 more deaths were reported in the period on 4 p.m. GMT time on Monday, taking the official toll to 21,678. But new data from the Office of National Statistics counting community facilities within COVID-19 was mentioned on the death certificate, indicating a higher figure, putting Britain on track to being as badly as affected as the worst hit nations, or even worse. From tomorrow or today, we will publish not just the number of deaths in the hospital each day, but the number of deaths in care homes and the wider community too, Health Secretary Matt Hancock told the reporters. A total of 21,284 deaths in just England were due to the coronavirus, compared to the official announcement on the day of hospital deaths from National Health Service, NHS England, to 13,917. Hancock has confirmed that 4,343 had died from COVID-19 in care homes, but said that the proportion represented about a sixth of the total toll. It was just below what we would see in the normal times, he added, but he rejected claims that the government had not done enough to protect the elderly residents and that those at most risk from the disease and social care staff on the front line. One of the difficulties in getting accurate data was due to the estimated 15,000 largely private care home sector being part of some 10,000 different organizations, he said. Getting a true picture of the number of COVID-19 deaths in Britain is complicated, as the developed administrations in Scotland and Northern Ireland report deaths outside the hospital separately, that and different reporting periods for registrations of death had led to varying estimations in British media. But the statistics underline a wider problem in the British government, which is under pressure to reveal a strategy for easing down a national lockdown imposed that was made on March 27th. Our Prime Minister Boris Johnson, who returned to work this Monday after recovering from COVID-19, had indicated that the strategic restrictions would not be lifted anytime soon. Hancock said that the key criteria remained getting the daily death toll and infection rates down. The government has set itself a target of testing 100,000 people a day for COVID-19 by the end of the month, and had widened its regime to care homes and the over 65 and those who are unable to work from home. It is also looking to launch a smartphone contracting application in the coming weeks to alert members of the public if they have been in close proximity with anyone who develops symptoms of COVID-19. Back to you, Alma.
Okay, so Caroline, you're from our EBC Scotland Bureau. Scotland is part of the UK, so what is happening in Scotland as well?
So the country's lawmakers are looking to pass an emergency coronavirus bill designed to give Scotland increased powers in protecting its 5.47 million citizens from COVID-19. Although many new regulations and law have been passed by members of Parliament in London are forced in the country, areas of which the government has developed power required in new Scotland-specific laws. This includes the courts, businesses, and housing regulations. The Scottish Government admits that there will need to be a big significant adjustment to the operation of public services and businesses to keep Scottish courts running and dealing with serious criminal trials. Everyone from judges, solicitors, lawyers, the accused, witnesses, and the jury will be able to appear via video link. The bill also gives renters of homes greater protection from eviction during this pandemic lockdown, with a minimum of notice of 6 months from the landlord that they can give to the tenants. After the bill has passed, Holyrood will be closed for several weeks to allow the pandemic to pass. The new legislation has a 6-month limitation after the politicians would need to vote to continue the new laws for another 6 months if it was necessary. Also, to assist Britain's National Health Service in treating people hospitalized by COVID-19, a new medical facility, NHS Louisa Jordan, which was named after a World War nurse, has opened up in Glasgow. It has an initial capacity for 1,300 coronavirus patients, with the option to expand to accommodate more than 1,000 people. The facility mirrors the new NHS Nightingale and a huge coronavirus dedicated temporary hospital in the ExCeL Conference Centre in London.
All right. Thank you very much, Caroline, for your updates. We'll see you soon. Stay safe, stay home, stay healthy. Thank you for your time.
Thank you, Alma. I'm Caroline Kennedy from Glasgow outside Scotland, and we live in interesting times.